about supplementation and food fortification, my perspective is that these are critical public health strategies when appropriately implemented. We all know there's a problem with hidden hunger, with micronutrient deficiencies. This particular map attempts to look at the severity of the issues, looking at 5 micronutrients, specifically iron, folate, iodine, zinc, and vitamin A. I will say that this map is accurate in as far as the data allows it to be. We know that some of the data is quite old. For example, the blue dots, that's iodine specific, and a lot of those data are coming from countries where we have not seen urinary iodine concentrations measured since the 90s. However, where we do have updates on some of the biomarkers for these different micronutrients, we are not seeing a tremendous change in micronutrient deficiency. There are, of course, there is progress, but not the kind of progress we would hope to see. I do believe part of the solution is the evidence-based interventions of supplementation and fortification. I believe that they are cost-effective and that the evidence is showing that there are health outcomes when they are delivered appropriately. So, for example, if we talk about supplementation, and specifically vitamin A supplementation, the evidence is pretty clear, except for a few outliers, that mortality and morbidity is decreasing due to vitamin A supplementation programs, of which there are 80 around the world. In terms of food fortification, we've seen in the developed world quite a lot of progress, as you would all know, in terms of iodized salt and folic acid fortification and the prevention of iodine deficiency disorders, as well as preventable birth defects, for example. We are starting to see the same evidence come up in low and middle income countries, which is quite exciting. If we jump down to the 3rd bullet under food fortification, there is a review which took place last year looking at 76 studies. Out of an original, I think there were 20,000 manuscripts that below 76 were actually maintained because they fit the criteria. These were studies that were done in the real world, national level, in low and middle income countries, looking at food fortification programs. And there is now strong evidence that the impact and the health outcomes among women and children of those food fortification programs was quite good. And that's coming out through a Camber review process later this year or January. So I think that's going to be an important piece of evidence. Also, in terms of salt iodization, we are now seeing only 25 countries globally which have, at the national level, insufficient intakes of iodine, whereas only a little more than 10 years ago, that number was 54. So from 54 to 25 today, and we're hopeful with our partners at the Micronutrient Initiative, UNICEF, governments and private sector, of course, that we could help to prevent IUD once and for all and control it globally if we can continue to roll out salt iodization. We've also seen the preventions of hundreds of thousands of cases of birth defects due to folic acid fortification in countries like South Africa, the US, and Canada. And again, the evidence in low and middle income countries is growing for folic acid fortification as well. There is a high return on investments depending on the delivery channel that you choose, supplementation versus fortification, and the micronutrient returns can be upwards of $30 for every dollar spent. Now, and this is where I think you'll start to see that even though on the actual agenda I am very much pro-fortification, I do not believe it's a panacea. I will come right out and say that. I'll say my colleague here, Mowgli, he's already convinced me of that. I came convinced, of course. But I think we need to have an appropriate objective of what staple food fortification and condiment fortification really can do in a given country. I do think perhaps 15 years ago, when organizations like GAIN and others were established, there was a notion, go into all the world, fortify, and micronutrient malnutrition. And of course, it's much more complicated than that. But there is a real opportunity, I believe, to actually shift the distribution of intake in a positive way across entire populations, including target groups, including women of reproductive age, pregnant and lactating women, and children. And here we see just an illustration of what those distributions of intake can be. If we see that dotted vertical line, which would represent for any particular micronutrient what the adequate intake might need to be. And we see that the blue line is where the population is. And so you have a bell curve going up quite high, but in general there's a deficient population in a particular micronutrient. And what fortification is trying to do is move that blue line into they're not going to necessarily end micronutrient malnutrition among all individuals in society. But the good news is, coming out from the evidence that I talked about earlier, and through numerous national coverage surveys of fortification, as programs mature, as industry consolidates, and here's a critical one, as fortifiable foods become more accessible, because not all food, in my opinion, is fortifiable through a market-based approach. As all that happens in a given country, and it might take 5-6 years, the penetration or the intersection of the consumption of fortifiable foods and vulnerability increases, which means target groups can be reached, and a meaningful contribution of fortified foods can make a difference to a person's diet. Just really quickly, I want to look at a few maps. Going back to the story of iodine, this particular map is showing that there are now 25 countries, which are that darker purple, that are either moderately or severely iodine deficient at a population level. This is down from 54 just a little more than a decade ago, and we are seeing what we really feel is the last mile, and we can achieve that in the next 5 to 10 years, and actually see this entire map turn gray. In terms of grain fortification, there's also been tremendous success, I'd say, in terms of legislating it. 85 countries today have mandated some form of grain fortification, so wheat, or maize flour, or rice. The big issue here, and we'll talk about it in a minute, is the coverage adequate, and is the quality of those fortified foods adequate to make a difference to the diet. This is a map to represent what is the fortification of edible oils, ghee, and margarine around the world. There are now 50 countries approximately that have mandated, with vitamin A, and in some cases vitamin D and vitamin E, the fortification of these food vehicles. And they're in purple, and there's also evidence that vitamin A deficiency is decreasing in some of these countries where there have been proper effectiveness reviews. And we're not talking about efficacy, because efficacy is proven, it's effective, it's actually showing these programs at scale are working. So what I think is the way forward? I think the way forward is that we need to improve coverage, we need to improve quality. Vitamin A supplementation programs, there are some 80 out there today. Quite good coverage. We're looking at about 70% on average across those 80 countries. That's taken from UNICEF's State of the World Children's Database. State of the World's Children's Database, excuse me. But some countries are very low, 20% coverage of those programs. Similarly, for fortification, we have very, very little data on the effective coverage of staple food fortification programs. We have it for salt, but we don't have it for staple food. In the last 2 years, there has been a tremendous effort by the different partners, ANEC has been one of them, to roll out what we're calling national fortification assessment coverage surveys. And we now have for 10 countries in Africa and in Asia, national data showing at the provincial level, at the district level, what is the consumption of staple food that is fortified, and what does that mean for the diet of the individual. And we are now able to say 60% of rural women in Senegal, for example, are now consuming fortified edible oil that represents a minimum of 10% RNI or vitamin A intake, which is quite exciting, and sometimes it's upwards of 20 to 30%. The second big issue moving forward, I think, is we must improve quality of fortified foods. A 2015 review that we were involved in was testing through laboratory analysis the actual micronutrient content of these foods, and we're finding on average that they are under-fortified by 50%. This can be due to businesses wanting to save costs, government unable for various reasons to properly enforce and regulate, and of course, if foods are under-fortified and not reaching the WHO level, the standard that's been set, we're not going to have the health impact that we want. So I think improving coverage and improving quality is critical for the future of supplementation and fortification. So in summary, what is my position? My position is that fortification and supplementation are critical public health strategies that are relevant, and they can help shift entire populations in a positive way towards better intakes of essential vitamins and minerals, including in the reproductive age and including among children. Where are they relevant? Well, I would argue that where existing food supplies are failing to deliver those essential vitamins and minerals today, and where there is a relevant food vehicle, meaning it is processed at scale and is fortifiable and consumed at high enough levels that the population will have a meaningful intake of that food. They are evidence-based, they're cost-effective, but there is still a major need to improve the coverage, improve the quality, so that countries throughout Africa and other parts of the world can build, can improve, can sustain these fortification programs for better health impact. I do think we need better data so that we can make decisions on optimizing these programs. And here's the kicker, and I'll hand it over to my colleague in a moment. I do believe fortification and supplementation are complementary. They are not the panacea. We must have other interventions like dietary diversity, nutrition, sensitive agriculture, wash and sanitation, if we're going to end it. Thank you very much.
Thank you very much. So I'm a little bit concerned that we're going to agree with each other for this a lot. So I think my role is going to provoke you.
So as you can see, this is not a Hillary and Trump debate. And I think that we can do the debate because my opponent, Greg, has agreed that fortification, supplementation is not a panacea, but it's complementary. I think I share his position. However, we still want to ensure that we are all in the same position. So how many of us here believe in the position that fortification and supplementation could be a panacea for addressing vitamin and mineral deficiencies? Can we just show by hand? Okay, we have one hand up. Okay, good. At least we have somebody voting in favor that it's a panacea. We know it's lunchtime, so we're going to be very short. And I think this is not going to call for a vote. So, you asked when I was contacted to undertake this debate on whether fortification and supplementation is a panacea for addressing vitamin and mineral deficiencies. After 7.5 years of working with Marocaine International to advance food fortification across the African continent, and now moving to FAO, I said no, it cannot be a panacea. How can we have supplementation and fortification become a panacea for addressing micronutrient deficiencies? We definitely have had several speakers speak throughout the week on the need for multisectoral engagement and the need for integrated approach to addressing vitamin and mineral deficiencies. So certainly, it cannot be a panacea. I completely agree with Greg that this is complementary, but of course very promising in terms of impact in improving overall micronutrient well-being. Now, I'm just going to reinforce some of the points that were made earlier, but if we look critically at the underlying factors to micronutrient deficiencies, you'll realize that we have several of them, and therefore we have several entry points to improve on our overall nutritional well-being. So you can look at low micronutrient density in the foods that we are eating. For example, if you have animal sources, you can have, they are more bioavailable for specific micronutrients, for example, retinol from animal sources. Poor combination of diverse foods. Even the soil in terms of the concentration of micronutrients in the soils and how that affects crops. The levels of micronutrients in specific crops. For example, you take zinc and the quantities of zinc in cereals. The amount in the soils can influence the amount that is in the final product. You look at infections. They play a critical important role in how much nutrient is being used and the secretion factors. Monotonous diet, we need to encourage dietary diversification, soil intestinal parasitic infections in terms of schistosomiasis or worms could also affect the amount of micronutrient that is being used. So critical questions that we need to be asking ourselves, and having worked in the fortification area for a long time, Greg has already brought the issue of coverage, which is a very, very critical factor in the success of food fortification programs. Before we undertake a fortification program, we undertake what we call fortification rapid assessment surveys. This allows us to understand what proportion of the population are consuming specific staples or condiments. So we're targeting food vehicles that reach significant proportion of the population from 70%, 80% and more. So you're looking at salt, you're looking at wheat flour, you're looking at cooking oil, vegetable oil, you're looking at bouillon cubes in some context, and sugar in some context. So coverage is key for success. And as Greg indicated from his slide earlier on, currently we can say that sustained in countries where we have mandatory fortification for specific staples, we are covering 45 to about 50% on a very regular basis. That is if the food is being consumed on a very regular basis. So that's the challenge. But if you take certain categories of the population, for example, we take children, how much fortified cereal flour that is fortified under mandatory regulatory frameworks is being consumed by children under 5 years? By virtue of their stomach sizes, they can only consume so much. So therefore, you would need to fortify targeted voluntary fortification for specific complementary foods to reach this group of population with specific levels of micronutrients in those foods. So you need, most of the time we plan based on adult population. And even within adult population, we are looking at meeting, for example, 30 to 50% of the recommended dietary allowances for specific micronutrients. And even that, at the level of industry, you will still need to add what we call overages. So you are adding overages because as the product, for example, take vitamin A, as it's going through the distribution channel, through marketing, you are losing some amount of that. So you need to add, even at the industry level, some overages based on the normal standards that have been established by government to cater for those losses within the distribution chain. So there are huge major challenges that we are faced with when it comes to the efficacy, effectiveness of fortification programs that needs to be addressed for us to be able to meet the gaps that we want to achieve. How are we addressing the gaps in terms of compliance and regulatory frameworks? A lot of countries have set standards, but they don't even have the capacity. The laboratories do not have the appropriate analytical devices to be able to enforce, monitor and enforce the standards for these food fortification programs. Are we assessing the contextual and dietary habits when it comes to planning food fortification programs? For example, you take specific countries and context, they drink a lot of tea, they consume a lot of tannins and phytates in the diet, which could affect micronutrient absorption. For example, you take iron, for example, the amount of phytates and tannins and anti-nutritional factors go a very long way to influence the bioavailability of iron. Are we taking those into account? So could we confidently say that micronutrients, any micronutrient intervention, fortification supplementation could be a panacea? No. So at the level of FAO, we are not talking about having focusing on one particular program, fortification or supplementation. In the context of food fortification, we are looking at it in a very holistic way, where we have this integrated approach of bringing in the different other micronutrient interventions to ensure we cover the micronutrient needs of our population. So if you take any food fortification program, you're looking at ensuring effective partnership building, which is very much aligned to what we want to do in the overall nutrition agenda in terms of multi-sectoral engagement for nutrition, promoting the nutrition agenda. If you take enabling environment through regulatory framework, very important to ensure that we capacitate our laboratories to be able to enforce these standards that are being established. Monitoring and evaluation, production and distribution, social marketing, we are actually linking social marketing and nutrition education because they're very much complementary in changing behavior, so that people would be able to identify fortified foods, make those choices to consume fortified staples, whilst at the same time they're very cautious of the amount of sugar, for example, that they'll be consuming, of the amount of salt that they'll be consuming, even if the salt is iodized. We are not saying because the salt is iodized, you should increase consumption, but we are saying that if it is 5 grams that is recommended by WHO for consumption as a normal amount of flour of salt on a daily basis, we iodize that quantity to meet the gap in terms of iodine deficiency. So it's an integrated approach when it comes to making effective impact. And in my current role with FAO, a key intervention, and for us all, we all want to be very good person, we're going to go for lunch, and you'll see people will make different choices of foods. They want diversity, they want to taste everything. It's a normal human feeling. So, and actually, we've demonstrated through research that as you increase the diversity of your foods, you actually increase the micronutrient profile of your diet. And this graph is a simple graph that is demonstrating how, as you increase your food groups, you actually increase the probability of adequacy over 11 micronutrients. So as you increase diversity, increase the micronutrient profile. And that goes a very long way, even in the amount of specific micronutrients in breast milk, for example. So we need to encourage dietary diversification, and we need to invest in that. Prerequisite to food fortification in terms of the choice of food that is consumed by a significant proportion of the population, consumed on a regular basis, centrally processed. This is also another major challenge when it comes to African countries. Our industries are not developed when it comes to specific traditional food groups. And actually, middle class is shying away from traditional ethnic indigenous foods. And the private sector is coming in so strongly, and our diets are now being limited to 3 cereals: rice, maize, wheat flour. Most people have their daily caloric requirement provided through those 3 cereals. And a lot of our local indigenous foods are becoming extinct, and private sector is not investing in adding value, in transforming the food, and adding value to the quality of those foods. And that is where we need to be focusing on. And factors on organoleptic effects of even specific fortificants. For example, you take flour fortification. Depending on where the source of iron is coming from, that could affect the organoleptic property of the fortified flour. So we're talking of ferrous sulfate vis-a-vis ferrous fumarate or sodium ion EDTA. Depending on which one you are using, and as the bioavailability even increases, you realize that we have more challenges when it comes to organoleptic effect on the food. So this slide is just to show that we need a compendium of actions to be able to meet our micronutrient requirements. And I'm not going to belabor the point. Water and sanitation plays a critical role. Your environment and water, sanitation, they play a huge role. Care practices plays a significant role in the micronutrient requirements. I'm going to encourage all of you to go back to the Rome Declaration of the Second International Conference on Nutrition. We have 60 recommendations that cover key actions, key interventions that can actually ensure that we meet the nutrition requirements of our population. And I encourage most of you here as researchers to go back to this document and use them for your advocacy process and research. So food fortification and supplementation are very necessary, but they are not sufficient. They are not panaceas. Sustainable, climate-smart, nutrition-sensitive, healthy food systems, which encompasses integrated interventions, including fortification and supplementation, could be said to be panaceas. So how are our future food systems looking like? And how are we advancing the nutrition-sensitive food systems in Africa? Thank you very much.
Thank you very much, Maureen. Okay, about 2 minutes to respond to any of those issues where there's points of conflict between you.
I was reflecting on the presentation. I think there's definitely more points we agree on than disagree. There is one question I would put to my colleague. I firmly believe fortification is, one, underutilized, and two, it's not necessarily delivered well in a lot of the world. And I think we need to make sure countries that aren't currently fortifying, where there's a relevant vehicle, should start. And those that are existing, those programs that are existing, they need to do it much better. And I'm not pointing the blame on any particular country. In Europe, we have a big issue as well, in Switzerland. And there's programs that are not working well in Europe on fortification. So I think, other than that point, I would more or less agree with most of those.
You see, if it was Trump